Outreach Prevention and Intervention Strategies in Tribal Communities, a focus on child safety. This is Kea Chilka, and I am with OJJDP's National Training and Technical Assistance Center. And I would like to take a couple of minutes to discuss the features of the Connect webinar platform. For those wishing to download a copy of the PowerPoint slides and other important documents, you may do so by locating the handouts pod directly above the chat area. Click on the name of the file and then click the download button. At the end of today's webinar, there will be a Q&A session where the presenter will address some of the questions posed during the presentation. Please type your questions in the chat box as they arise. For those of you participating in today's webinar as a group, please take a minute and help us. Go to the chat window and type in the total number of additional people in the room with you today. If you're viewing alone, there is no need to type any chat pod at this time. Finally, this event will be archived in approximately 3 weeks on OJJDP's online university at www.ojjdpou.org, where you can check out past webinars. Again, thank you for joining us today. I will now turn it over to Melissa Hansen from Fox Valley Technical to begin today's webinar.
Thank you, Kea, for that introduction. As Kea mentioned, my name is Melissa Hansen, and I am the Region 2 Liaison with the Amber Alert Training and Technical Assistance Program. The Amber Alert TTA program has partnered with OJJDP's National Training and Technical Assistance Center to host this webinar as part of our Amber Alert in Indian Country webinar series. In conjunction with our mission, this series works to effectively address the needs of victims and increase collaboration between state, local, and tribal communities in response to the exploitation of children and other forms of child victimization. To learn more about the Amber Alert in Indian Country initiative and to view past webinars with today's presenter, Melissa Riley, please visit us at www.ncjtc.org/AmberAlert. Before we begin, I would like to remind you to submit your questions via the Q&A box located on your screen, as we will answer those questions at the end of the presentation. And without further ado, I would like to introduce and turn today's presentation over to our presenter and subject matter expert, Melissa Riley. Melissa?
Hi, good afternoon, everyone, and thank you, Melissa, for that introduction. My name is Melissa Riley, and I am calling in from Laguna Pueblo, about 50 miles west of Albuquerque. So glad everyone could join us today, and I know that there's been some technical audio difficulties, and I appreciate everyone's patience and hanging in with us. If you are still hearing the echo, call in again through the toll-free line, and hopefully you'll get a better sound. Without saying any further, just to give a little information about myself, especially for those of you that haven't been able to join us on the past few webinars. My name is Melissa Riley. I do a lot of training and technical assistance out here, not just in New Mexico, but around the country in several different areas of victim services and program development, etc. So a lot of what we'll be talking about today in regards to outreach, prevention, and intervention related to child safety issues is more of my own personal practice, what I've seen out in the field, also within Indian Country as we know it, as well as a lot of research and education that I provide with the groups that I work with. So any questions, if we could hold those to the end, I'll be happy to answer those. But what I'm hoping that you'll gain today from today's webinar is some different approaches that or considerations that should often be taken when doing any type of outreach, prevention, and intervention. Child safety is the utmost importance, I know, in every community that I've ever worked with, and I hope that that continues to grow. But there's a lot of thought that goes in the process of developing any type of these programs as it relates to understanding more so the the communities that we're working with, the needs of the community, as well as technology, looking at information, where we get it from, and how we use that to draw in people to take child safety under their own interests. So here are some learning objectives that I've identified that I hope that we're able to achieve today, which is to identify the different intervention, outreach, and prevention strategies, methods for enhancing child safety messages. Some main points that I'll be hitting on today are looking at some of the common messages that we currently have in our communities, or that we often see, not just within our communities, but within the state and national arenas as it relates to violence and everything that we try to do to prevent or decrease the amount of violence we see in our communities. I also want to talk a little bit about stimulus, meaning, and strategy. What are the things that really draw in people, and what type of messages are we trying to get across? And also really defining outreach, prevention, and intervention. I often see in working and doing the work that I do that sometimes the definitions or the terms have been used interchangeably, but they're actually different. And the final question or final point is, how does it all work? How do we get to the level of getting the buy-in and the positive feedback that we need from communities? So Melissa, I'm going to go ahead and turn over the first poll question to you. Do you currently, if I could get everyone's participation on this, so Melissa, go ahead and move forward.
If you could, if someone could answer, do you currently conduct outreach, prevention, and or intervention activities in your community? So either yes or no. And so it looks like about 70% do currently conduct outreach, prevention, and or activities in their community.
Okay, great. That's excellent, and I think that's a good number and a good point to start with. It sounds like we have a lot of folks that are really getting involved in either one of those activities, so that's important. For those of you that are not involved, it's probably because you have so many other things going on in your organization and just don't have the time, or maybe that's not a part of your delegated duties, and that's fine too, because oftentimes you're the people that we rely on to get that extra help we need in the office. So we have another poll question. Melissa?
Yep, so our next question is, how would you rate your community's response to your activities? Either good, fair, or poor. So it looks like about 50% would rate their community's response around fair, 50% at fair.
Okay. All right. Well, you know what, I think that's a really good, I think as long as you're able to identify whether you're doing good, fair, or poor, I think that as long as you're able to evaluate your message, that's always a good starting point for how maybe you can do things different or better the next go-around. So I always take that as, just a learning tool personally to try to get things going better in the next go-around, especially Child Abuse Awareness Month, Domestic Violence Awareness Month, Crime Victims Month, and those types of months that we tend to do a lot of community activities. So Melissa, can I go ahead and get the slide back up? All right, thank you. So one of the most important things, not just with any type of prevention, outreach, or intervention messages that we want to send out to the community, I think it's also important to see how we deliver our services on a day-to-day, because that really aligns with the type of intervention, outreach, and prevention strategies we use, whether it's on a daily basis or whether we're doing it in recognition of a specific month, like the months I just mentioned. But when we're constructing all of these messages that we really want the community to take notice of, or our clients, there's three important things in developing those messages, and it's identifying a stimulus, like what is it that we really need to get the community jazzed about. For example, our Highway Safety Department, Federal Highway Safety Department has really taken issue with buckling up. It saves lives. Here in New Mexico, we have a really heavy message board throughout all of our highways about buckling children up because it's the law, DWI, those types of things. So we really need to figure out what type of stimulus that we're trying to use, or the message, and the meaning behind those things, and the strategy that we need to achieve the full effect of what we're trying to do from an outreach, intervention, and prevention strategy. So some examples that I have here are the stimulus, for example, with don't cross the street without looking, which is something we tell our kids. We've been told, I tell my grandkids. That's an important message to get. And the stimulus here is don't cross the street without looking. The meaning behind that is if you don't watch the street before crossing, most likely, or it could happen, is that you'd get hit by a car. The strategy is that we want whoever's receiving our message to look both ways before crossing the street. And I know it might sound like a little bit of a strange example or a silly example, or you're wondering where I'm coming from with this. But if you think about the everyday messages that we receive and what the messages that we're giving, the messages that we're trying to get across, we really need to figure out what stimulates the group and the meaning behind our message and the strategies that we need to share or give to everybody in order to feel the full effect or the meaning of the messages that we're trying to get across. So on our next slide, traditional messages, we've heard, child protection is definitely something I hold dear to my heart. Child abuse, the common message we hear is child abuse hurts everyone. And we see images such as the one here on the slide that says children cannot stop child abuse, adults can. So in here, I was trying to find things or examples for all of you where you might, the stimulus here is that child abuse hurts everyone. The meaning behind that is, we want to stop child abuse. But the strategy isn't clear. So in working in tribal communities, and for those of you that have been on the previous webinars with me since April, one of the issues that I'm very big on is that we really need to understand our tribal communities, because not every tribe is the same, not every Alaskan village is the same. Sometimes our history or historical background is so different that we need to really take these into consideration whenever we're developing messaging for communities. If we're not giving people a step-by-step or a message that's relevant to where we're at that given point in time within that community, oftentimes these just become taglines. And people say, well, yeah, I saw the child abuse poster, well, okay, I see that it's wrong. But oftentimes, whenever we talk about child abuse, or at least in the work that I do with tribal courts around the country, sometimes I will meet clients or community members who don't understand the definition or know the definition of what child abuse is within their community. They might often say, well, hitting is child abuse, but they don't maybe correlate neglect or emotional neglect with child abuse or other areas that are identified within their tribal code or even the state code if you're in a PL 280 state. So it's really important to expand on the messages so that you're giving more people more education about not only what it is that you're trying to achieve to stop child abuse, but also informing them about what the local laws are and how do we stop this. If someone is abusing a child because maybe they're overwhelmed, then the strategy to get to that previous message we just had would be to maybe ask for help. Go see your local social worker agency. Talk to a community member or a traditional leader or faith leader. So those are the strategies that I'm talking about, is that I think we need to be more thoughtful about how we're giving the message and the resources that we're talking about to really get going beyond this. Here, I just exactly what I've mentioned, the stimulus would be any physical or emotional harm to a child or neglect of a child is abuse and it is against the law. The meaning, you could seriously hurt your child and go to jail. I mean, that's really the background or the meaning that we give with certain parents or certain audiences. The strategy is to get help if you've hurt your child or want to hurt your child. So in this one, I had an image here, but it was deleted, and I understand. But one of the things that doesn't resonate well when we look at feedback or the outcome of maybe sexual violence or rape or, any form of violence is that shock and awe. An image of a woman beat up and maybe sitting against the wall or in the corner, or a child sitting in the corner, those really capture your attention, but the attention isn't so much that it carries out so that throughout the day or the week, as someone says, wow, I'm just going to go out and spread the word and share what information I have about what child abuse looks like. And the reason why I say that is that we oftentimes in a lot of prevention, outreach, and intervention strategies, some folks may feel that they need to use pictures and images like that. But if your audience is the overall community, and you're giving that image to them, it's something that isn't truly resonating with them, so that you see actual decrease in numbers maybe across the state, your region, or the country. So sometimes I have to ask whether shock and awe images and messages are truly effective. Some of the feedback I've received from folks that I've worked with is that they don't resonate well with them because the pictures are too graphic, or it could be that the message, the written message isn't strong enough and correlates with the image itself. So if you want to stop the violence, we need to find other avenues to send out the message without stereotyping what we often see on violent images, because we have to remember a lot of people are so desensitized to images of violence. They watch it in TV, they do gaming with it, Facebook has images, YouTube, that do shock and awe really work? So consider the appropriateness of your message and the audience you're trying to reach. Before we do the poll question, Melissa, I'm going to go back to the slide real quick. what I mean by that is that oftentimes if we're doing a message, one single message, I'm going to use this as an example. For Child Abuse Awareness Month, when I was working within a child abuse, or excuse me, a child protective agency, we would go and we would do presentations not just with the community and in adult forums, but we would also do our messaging within the schools. And sometimes the messaging that we used all the way around was the same, and not being aware of children's ability to register and comprehend what we were saying sometimes didn't have the effect that we would have liked it to have. We may have received more children saying, oh yeah, there's been times when my mom has yelled at me and I want to report or say that my mom's abusing me. And those were rare occasions, but it was not uncommon to hear those reports from the school after we had done a presentation, because at times the discussion of abuse and violence with them, the message wasn't at an age-appropriate level. So we need to be very thoughtful of the appropriateness of the message with the audience we're working with. With that being said, I'm going to go ahead and turn it over to Melissa for the next and final poll question.
Yes, thank you. So the next poll question is, do you create your own outreach prevention or intervention material for community distribution? Yes or no? So it looks like 60% or so do not create their own material.
Okay. So that is going to take us into our next area of discussion. How many of you all, and I can see everyone's chat in now as I'm going to look at this real quick, how many of you use IMIs or other national organizations to develop your outreach, intervention, and prevention material? Anybody responding? No? So you got Norma typing. Adeline, no, no, no. Well, good. Okay. So why I bring this to your attention is I've been, excuse me, I've noticed a lot, and maybe it's just within the organizations that I've done work with, but they reach out to organizations like IMIs, who has a Native American specific marketing tool that they use for foster parents, for almost any public health issue you could think of, or child safety issue. And some of the critique that I have, or the criticalness that I have of such material, is that it doesn't, these types of educational materials are not specific to the communities that they're being distributed in. Some people may see an image of a Native family or a child from another area, somebody that they don't know, that they can't connect with, and then the message might be, you know, grandparenting is, you know, 100% love or something like that. Well, that's true. That's true. But I think that whenever it comes to educational materials, developing them for whatever we're doing within our community, they should be specific to the community and not so much taking a message that has already been established. And a couple of reasons why I say this is that a lot of our communities, we have our culture, we have our tradition. Those of us that come from communities where we have our language, those things are very important to us. But when we talk about messaging, I think it's important to also consider how we can adapt some of our own local teachings and language into our messaging so that when people are getting our educational material and we're trying to get that message out about something we're doing, people can make that connection. They can say, oh yeah, that is important. That is something specific to my community. And oftentimes whenever we're buying bulk 5,000 Zimi cards or cards from other organizations that we order material from, well, those might be helpful for a very diverse audience or an audience that primarily is maybe working in an urban setting, but I think that we need to take a little bit of time to think about what we could do locally so that all of our messaging relates to the area that we're working in. This next slide, and for those of you that have been able to look at my my profile or my background, you'll see that my area of education, my PhD is in education and working with higher education institutions. But I use this, it's called Haro Cycle of Socialization, because it's something that I think is very applicable to the communities that we work with in Indian country. Is first being able to understand that, every single person is socialized in a very specific way, that we've received messages from institutional and cultural organizations, institutions such as church, schools, television, etc., and that we learn a certain behavior. We learn how to be who we are based on all of these experiences, whether good or bad. So I use this as a platform or a foundation to try to help people even if I'm doing counseling or social work, to help people understand that, we have to be very eclectic in the work that we do with our tribal community. So one size fits all isn't always gonna work. Messaging, best practices, those types of things. Those things need to be developed at a very community-specific level. So how do we prepare to do any type of intervention, outreach, and prevention? Well, a few basic questions. How do we know we have a problem that needs to be addressed? Who is responsible for responding to the problem? And what is the best approach to address the problem? We know that we do have incidents all over the country regarding child abuse. There's different forms that we may have a higher number of issues or rates going with than we do another area of child abuse. And I'm going to use this example. I'm sure a lot of you who have been in this field for quite some time remember when we were pretty high up on the trend of cyber stalking and cyberbullying. That was, well within 10 years that we really got high in the federal level about talking about such issues. And going out and doing the work with specific tribal communities, a lot of folks are saying, yeah, so what are we going to do about this problem? But when you got right down to it and you looked at the most rural tribal communities, even out in our Alaskan villages, well, some people, it might have been like 1 out of every 5 or 10 households that maybe had access to technology. It might have been that, 1 out of every 3 households actually had a cell phone that, maybe the flip phones that we were starting out with back then. So whenever we were saying we had a huge cyberbullying problem or cyber stalking, and we were trying to take that message and apply it to our tribal communities, we really didn't have those numbers as high as we did with a lot of our tribal communities because of technology. We didn't have it as high as we do right now or access to it. So we have to be really careful about the messages we try to take on and try to apply to the community. And this really involves us as providers to get really involved and look at our casework, look at our monthly intake forms. How much of a problem are we seeing with neglect, emotional abuse, physical abuse, medical neglect? And I think those should always be the starting point for any messaging that we're trying to do when it becomes a huge problem. And that's by validating through our own casework and our numbers and our CPT meetings about what issues are before we go really high full force on, trying to say that child abuse overall is an issue whenever it might be, well, we've got a casino, so we've had 20 calls of neglect or child abandonment, within the area, as opposed to maybe 3 calls of physical abuse. So that's what I wanted to use as the example. The other part of the preparation is what does the data tell us about the problem, which I just mentioned, and who will be our target audience. If we see that we have a lot of case information or referrals and we substantiate cases and we find that maybe we have 70% of our cases are single mothers between the ages of 20 and 35, well, maybe that our target audience should be stronger messaging about options available for single mothers between that age that are realistic. So that's an example of what I mean about our target audience. We not only want to approach the whole community, but sometimes our messaging needs to be more specific. So key requirements of a good message. It needs to be true. It needs to be true. If we say we have a problem with cyber stalking or teen dating violence, we need to have the data, the actual data to prove it. We need to be able to have actual data to show that this is indeed a problem. So things need to be true in order to get the community on hyper alert. It needs to be approximate or accurate. It needs to be reliable. It needs to be respectful, and it needs to be relevant. It needs to be community relevant. So some of the questions or that I ask of communities that I've worked with is when they say we have a lot of child abuse in our community, is that really true or false? If we have a tribal community whose population might be 1,000, and we're a social services agency and law enforcement office where maybe we have 10 law enforcement and 4 people in our social services agency, and between the 2 of us and the schools and other agencies we work with, we have possibly 12 referrals coming in every 2 weeks, and we substantiate maybe 3 of them. Can we actually say we have a lot of child abuse in our community? So that goes back into really looking at our data, looking at those substantiated cases versus case referrals. If you've ever really noticed or taken the time, we have oftentimes a higher number of child abuse cases reported between April and June, and then through the summer months, and then they decrease in August or September when school starts. So we get people really hyped up. They hear our message about child abuse, and now everybody who's really listened to our message is really on alert about child abuse issues, as well as our providers. So we oftentimes see a slightly higher increase in our numbers, and then maybe through summer school we might have some increase in numbers, or sometimes we have a decrease, and that's because kids aren't being involved in activities with mandated reporters. So, there's lots of things that really correlate with the numbers that you see, especially during the holidays and so forth. So approximate or accurate, I just talked about that a little bit. We have 25 children in foster care. If we say that we've experienced a 10% increase in child abuse reports compared to last year, then those are things that are worth sharing, I think, in your message to the community as it relates to a specific topic. Reliable sources. Tribal council for certain communities that I've worked with will say, wow, we have this huge issue of child abuse. You know, these people are hitting their kids. That's not our way, and that's that type of thing. And then you ask them more pointedly about where they got the information. Well, that's what I heard from so-and-so, from so-and-so. But, you know, I know our leadership wants to take full advantage at trying to help us as service providers, but sometimes we really need the numbers coming from the sources who actually deal with these cases. Needs to be respectful. Working with children and families to increase awareness of child abuse should not be doing the shock and awe. Some people are already desensitized, so I think respectful of the community and using appropriate messaging is important. Relevant. Child neglect is one of the common forms of child abuse in our community. If that was something that you could glean from your child abuse intake forms and your monthly reports or your GIPRA reports, if you're BIA or you're funded through CJA or something, then those are numbers you actually get from your reporting. So those are numbers that maybe are helpful. It would be beneficial to share with the community, not the people involved or where things happen, but the actual numbers. Also needs to be relevant. Please buckle up your children before you start the car. I mean, the relevancy of our messages needs to be really defined. It really needs to be defined. It shouldn't be jumbled in with other things or giving people a mixed message. It needs to be relevant to what we're trying to do and the work that we're doing. If we're a social services agency and we're saying domestic violence is wrong or we're saying drunk driving is wrong, well, some of that, yeah, does relate to us, but we need to work collaboratively with the agencies that maybe are charged with focusing on those specific issues and to see how we could tailor the message down to really fit the area of work that we're responsible for. Outreach, what is it? A couple of definitions here. Effort to bring services to information or information to people where they live or spend time. Outreach isn't defined as intervention or prevention. What is it? Prevention is the planning for and taking action needed to stall an undesirable event. So that's what prevention is. It's taking a possible trend that you might be seeing in your line of work and doing whatever you can to prevent it from getting to a level where you're going to need some really high intervention of any kind. Intervention, it's an activity designed to motivate people in change or motivate change in people. And I get some people that disagree with me on these, and that's fine. I appreciate the disagreements and thoughts about how these are defined or explained to people, but they are important in determining what level of product or messaging we develop. If we're developing a tool that's meant to intervene, to get people to think differently about taking prescription drugs when they're pregnant, then that message needs to be an intervention message with resources to follow. You know, see your provider, see your obstetrician or, you know, a healthcare provider. An outreach is going to be something that's definitely going to be probably more of a softer message. So how does this work? Some key considerations, as I mentioned earlier, is looking at individuals of age, gender, diversity, and socioeconomic status. If you're possibly working, if you're someone, for example, who's living out at Navajo Nation, and you have a high number of elders that speak only the Navajo language, we don't want to be disrespectful and give our elders images and pictures that are inappropriate. Or if we say that, well, you know, if you've got a problem with this, better contact your healthcare provider or your insurance company, when we know that we're working with a high Medicaid population where we're depending on Indian health services, then we need to think about the types of messaging that we're giving to those specific groups. We need to think about the organizations, types of service, consumers of the organizations, as well as the employees. Like I said, if we already have issues in some areas of territorialism. Well, social services is doing this, and that's not their job, it's our job, that type of thing. We need to be thoughtful about staying within our arena. Also, community, looking at housing geographic. If we're talking about gangs and we're trying to do a lot of outreach or intervention, let's think about things that are messages that are related and relevant to that community, like, you know, signage that's going to be appropriate for that community, or that's not going to be so much condemning or hostile. Also, individual other strategies to think about, you know, and I think this is probably a most appropriate strategy with children and our adolescent teenage group, is individual contact with them on either prevention, intervention, and outreach through giving them one-on-one information, also offering them opportunities to maybe have group discussions or forums. Those strategies work best in those different messaging arenas because that gives them the opportunity to hear it one-on-one as opposed to just giving everybody at the schools a flyer. Organizations, policies, promotion, positive messages, and availability. Looking at what our organizations are, not only what we want to do, but making sure that it's aligned with our programs and our policies is always important. Community strategies, I think most best get more positive results when they're used in media campaigns, attending gatherings, newspapers, local newspapers, bulletins, Facebook, and those types of things. But these are, like I said, things that I see that have worked for me in the work that I do. And then also the final one, interpersonal strategies. For those of you that maybe do work with students for or prom, you know, sometimes we ask kids to sign a contract that they will not drink during prom, that it will be an alcohol-free. You know, asking people at a certain age, like with our students, to make commitments or sign contracts to those effect really give a more personal appeal and touch to any type of prevention, outreach, or intervention that we're trying to do within the community. I think avoiding abstract messages such as the one that you see on your slides here is important, and I say this because these are like the shock and awe I was talking about earlier, but also the relevancy. And for those of us that work with children and families, child abuse doesn't always look like this. sexual abuse, we might have a child that looks like any other child in a classroom setting, but the behaviors are obviously going to be different. But sometimes you can't see that in children. So it's important to avoid abstract messaging. Using messaging from other communities or other organizations that doesn't quite fit the bill for what our communities need. They need something they can relate to. This isn't always what an abusive parent looks like. For some parents, you would never know. So I think that using that shock and awe and saying that this is what a abusive mother looks like, well, it could be, but we really need to look at the messages or the visuals especially that we use to get our points across. Once again, using Casework for messaging, very important. Assess Casework from the last 1 to 2 years. What were the issues or causes that led your clients to you? If there was a downturn in your community and maybe an employer laid off people and we had a high number of substance abuse and child neglect, well, those are things to really take notice of. So what can we do as service providers to help? Maybe working with the local community college, the departments of education, tribal leadership to see what we can do to help forge a way for employment opportunities. And then also looking at what are the demographics of your casework. Do we have a high number, like I said, of young mothers, or do we have a lot of grandparents raising grandchildren? What are the resources missing from each of the cases? If you do your intake with families and you find that they don't have transportation, then what can we do to help with our messaging? What can we do? Maybe spotlight transportation as a desperate resource needed for our community, or maybe working with our CHRs to help us with transporting clients. What has worked for your clients? For those clients that you have that are success stories, that finished their treatment plans, what worked for them? What didn't work for them? At certain times of the year, once again, when do you increase and decrease in your caseloads, and what time of the day are most calls received and from who? So any time that you're using your like I said, or developing your messages on whether you're doing prevention, intervention, or outreach, looking at your own casework or your own organization first and seeing what areas correlate. If you wanted to do something with Child Abuse Awareness Month, those types of correlations are more meaningful because more often times than not what it is that you're seeing, and you can have more credibility and more accuracy or being approximate in the number of cases that you've seen, as opposed to saying Child Abuse Awareness Month, and don't abuse your children type messages. Well, the stimulus for a lot of these are going to actually be based on what you're seeing as a provider. And those are the most effective ones because most of our communities, we have cultural programs, we have cultural enrichment programs. So I think those aspects of the community can be built on, and we can see a lot of strength and resilience within our communities, as opposed to creating messages that are more hardcore shock and awe type things. So in conclusion, any type of outreach, prevention, and intervention should be based on your community and also your resources, like use what you have, and in between, try to build up resources that you don't have, or see where you can have other agencies work with you. And attempting to adapt to other messages from other communities or non-native communities really doesn't create that strong connection that you need about what your community's actual needs are. So thank you for joining me, and I'm so happy to finish up our third series of webinars. And with that being said, I'm going to go ahead and turn it over to Melissa.
Thanks, Melissa. So we did have a few questions, and I was hoping you would be able to address those with our last few minutes. And so I know we talked about this in a previous webinar, but could you let listeners know where they might find the most recent statistics regarding child abuse in tribal communities, or maybe some of the issues with, underreporting? If you could just briefly discuss the statistical information regarding child abuse, that would be great.
Well, we don't have specific statistics per tribal community. We do have a lot of Department of Justice, FBI reports, some BIA reports, but usually those are 1 to 2 years behind. So for a specific community, I think it's that community would have to divulge those numbers. But here, as I mentioned in our very first webinar, from a national level, we have over 3 million cases reported every year of child abuse, and we have over 6 million children that are deemed victims of child abuse. So if you take into consideration, okay, we've got 3 million substantiated cases, it's really hard within the tribal community or within Indian country to really say for sure the cases the number of referrals that we do get versus how many are actually adjudicated. So that those statistics are often hard to get, but I think if you're in a PL 280 state, you're probably going to get a good, healthy number for yourself, because the state or county offices are the ones that are charged with responding to child abuse and neglect cases. The other question, what are some good ways to engage a group of high school children and ensure their participation in a longitudinal program that aims to empower disconnected youth? That question, it's a good question, and I really do think that the sooner that you begin to engage a group and keep them going with set or specific times that you're going to be there, or that an activity will be offered, or the more consistent contact you have, the more often, the higher the outcome, or the better the outcome of any type of youth program. It's not enough to just go and present them with some ideas and get their feedback on something. With youth, you really need to show them that what their participation is doing is resulting in X, Y, and Z. So I think you really need to show them that developing that level of trust and that you're there, that you're going to help, will empower them to really keep moving on with your program and getting more informed, as opposed to just going and then you don't have any further relationship with them. I hope I answered that question. And Melissa, was there another one?
Nope, that's the last one. So I just wanted to thank you for your presentation today and answering those questions.
Okay, well, thank you so much, everyone, and I really appreciate it, and hope everyone is doing well.
Yep, thanks. I just wanted to let our listeners know that future webinar announcements from our Amber Alert Training and Technical Assistance Center will be made in the coming weeks. And without, for the next item, I will pass the presentation back to Kay and Christina for their closing comments.
Sure. We just wanted to say, to ask you, please take 5 minutes to complete online evaluation, which will be at the conclusion of the webinar. We also wanted to say that the webinar will be archived on OJJDP's online university in approximately 3 weeks. And for more information, please contact OJJDP, NTTAC, or Fox Valley. Here is the feedback link. Thank you again for joining us today. We look forward to hearing from you.
The host has left the meeting, so at this time, the meeting will come to an end. Thank you and goodbye.